Hello.
Hello, hello.
Hi, Gusto. Hi, Sarah.
Hi, how are you, Leslie?
I'm okay. How are you doing?
Fine, fine.
Yeah. Thanks for joining us today.
Welcome. Today's a decent time.
Yeah. How are you, Sarah? Oh, you're
Good. I
muted.
was just gonna say,
Yeah.
for Augusto, it's today a decent time, but I guess for you, no.
Yeah. I know it's an early one today. It's 4:35 right now.
Oh
But
wow.
I went to bed early, so I
Oh wow.
tried to. That's okay. I'll do a
That's
late,
real. That's
an
nice.
early end today. Start early, end early.
Welcome.
Mm,
Yeah, for these things, I'm glad to be caught in the middle, in
I
between
know.
Asia
Yeah.
Pacific and the Americas.
Yeah. It's always a okay time zone for Vienna, I think. Hmm. Uh, oh, so I should tell you both. I got a message from Carolina letting me know that unfortunately her friend's dad passed away suddenly. So she
Oh,
asked if we absolutely need her. And I said, no, of course. Like, please go be with your friend and we can use your video again. So I'll tell Mate too once he's here, just because I updated it in the moderator notes for today, that same document from yesterday. But Sarah, I wonder if we want to test the video because I don't know if you noticed yesterday, but Marie's worked perfectly. But for
yeah.
Carolina's, we could hear the audio, but the video was not
No,
like
there
it
was
was just
just
like
this
frozen.
one.
Yeah,
Yeah,
and it was a
exactly.
little
Yeah.
frozen. Do you want to test it together, or what do you think?
Yeah. I'm gonna try now.
Cool.
I think.
Yeah, yeah.
Oh, and I'll also tell you, Sarah, I got the email for the second webinar agenda. So one of them came through.
Oh no,
I
that's good.
never got the first one. I don't see it, but the
That's
second one, I was like,
super. It's
so
very strange.
yeah, but
That's
definitely I
very
got one of them.
strange.
So, sometimes you like forward emails and stuff. I always try and delete that unsubscribe at the bottom in case somebody else accidentally unsubscribes for you. Like I'll forward it to Benji and I'll be like, oh, can you send this to our members too?
Yeah.
So I sometimes worry that someone unsubscribed me. But then I got that one, so I thought, okay, well,
No,
it's not
well,
weird.
this was just sent directly from Outlook, so it was sent to everyone that
Oh,
I
shouldn't be.
CC'd.
Yeah,
But yeah,
strange. Well, I got one of them.
that's good. Somehow I can't find my video in the list of
Oh,
sharing. Maybe because there are too many videos open, oh, or too many windows. Mm. Oh, there's no.
yeah.
Here.
Here with all of you at least and the New York NGOs for trusting Intercambios to help organize this consultation. And
Did it
Yeah,
work?
kind of. It's working better than yesterday insofar as there is a video. Like it's not the little thing, it's on the video, but it's glitching. It's stopping and starting. Do you want to play a little bit
to all
more?
the NGOs which participated in the middle of the summer holidays for some of us
It
back
seems
there.
okay now.
I will address
Yeah,
specifically.
maybe just at the start it was a little choppy. Her
Yeah,
video
maybe
is a
then
little
just,
choppy, like the screen share, right? Like
yeah,
because you see it perfectly on your end.
I see it. Yeah, I see it
Yeah.
fine on my
But I
end.
think it's better than yesterday because the audio is not, it's just the video a little bit, but I think it's okay. Okay. So maybe it was just yesterday
Yeah,
something with
I
the
mean,
screen
I
share.
think that,
Sorry, go
yeah.
ahead.
No, I used a different computer yesterday, so I think my
Uh,
computer didn't recognize the format.
Yeah.
And this is Marie's.
No sound.
Sorry?
There's no sound.
There's no sound. Okay.
No.
Surgeon Communications at the International Drug
Now
Policy
we can
Consortium.
hear it.
Okay.
Yeah, seems okay. Okay, thank you.
And how are we gonna divide the slides today?
Yeah, so should I put the link in the chat to the same Google Doc as yesterday? I broke it up for both days, so the second day is in there. I guess Augusto,
okay.
maybe you didn't see it. I emailed it too. But I guess I can put it in the chat because as I think you were right, Sarah, nobody else saw it. 'Cause I was monitoring, you know how you see when people go into the document? I was like, if there's
Yeah.
an influx of other people, we'll know that my chat messed everything up. But there wasn't. So you were totally right. So here, I can put it in the chat again. I was having weird chat problems the whole time yesterday. Like I couldn't see any of the new, like I think at one point I said, oh, Sarah is going to put the agenda and the report, but you had already, right? When I said that, I couldn't see it in my chat. I kept like closing and reopening my chat. And then I finally would get like a bunch of the messages from the last, 10, 15 minutes. And then I would do the same thing. So apologies for that. I like couldn't see it on my side. So anyway, the chat problems did continue throughout the whole set. So I was glad when Mate, I mean, we needed to move along for timing, but for my Q&A, I was like, I can't see any of the questions. He's just going to have to read them to me because I can't see them. But I did just put it in the chat for you, the Google Doc. Yeah.
Yeah.
And I just crossed out the June 4th so we don't get confused. So if we just scroll down to June 5.
Okay, I think we just need to figure out how Ghana and Augusto are divided.
Exactly. Yeah, exactly. Because I know when we were on the call on Monday, was it Monday morning? Augusto, I think you were unclear about which couple you were. If you had written section 3 or 4.
I did the 4 and the 5.
Oh, okay.
Actually. Yeah.
So when Ghana comes, we can, yeah. So probably you'll do slides 4 and 5. But I think for you two, we'll just introduce you two together, and then you two can alternate. Like she can start with 3. Is 3 first? Is 3 part of that? Or no, it's just 4 and 5? Yeah, so she'll do 3, and then you can do 4, 5, and then she can do, what is it, 7, 8? Or
6, 7.
6, 7, yeah. But we can confirm with her when she gets here. But yeah, that should be fine. And you two can just pass. And yours will be back to back anyway, Augusto. So just pass to you and then pass back to her. Yeah.
And in terms of timing, should we, I mean, because yesterday we ran a bit late.
Yeah, we did. Yeah.
So should we try to shorten our part? Kind of, should I skip more of my challenges?
Yeah.
So
I mean, you were already so concise with 8, 9, 10. We have one more floor intervention today too, because we have Augusto, you're going to speak on behalf of Asia Pacific, or is somebody else coming? You're doing it, right? At the end?
Only me. I think nobody's coming from the Asia Pacific.
Yeah. Okay. So are you planning, did you prepare something, or did you want us to give you the
No.
floor at the end? Maybe we
I
can
did not
cut that
prepare.
if you, I mean, up to
Yeah, I
you.
didn't
We
prepare
ran out of
anything.
time yesterday. So, because we had 4 people. So if we, just for sake of time, I don't know, what do you
Okay.
think? Is that okay?
Yeah, that's okay.
You
I didn't
comfortable
prepare
with that?
anything. Yes.
Okay, we won't put you on the spot then. Okay, let me take that out of the flow.
Yeah, but
yeah.
still, I think it would be nice to have a bit more time for discussion.
Totally.
Because the discussion after the first kind of set of challenges, I think was really good and
It was,
it was very interesting.
Absolutely. And we should start maybe right on time today too, and just continue to let people in. What do you think?
Yeah, that's fine.
Yeah.
I mean, at the beginning, just, usually there are just 3 people, so that's why.
Oh, that was why. Okay, well, yeah, of course we won't start with just 3 people. Okay, cool. Let me update this then. So I'll remove Augusto from the floor. And then, yeah, I'll take a look back at my notes. Just so much good stuff in the human rights chapter. And it was such a like well answered section from respondents. There's still so much
True.
more I could say, but I mean, of course, we can't take too much time. So let me see what I can cut from there too. Okay. And I'll take Augusto out of this one too, so we don't get confused.
Someone dancing there.
Hmm?
Looks like someone is dancing tap shoes.
Oh.
Like Fred Astaire.
Hmm. Yeah, maybe I'll skip some of the things that are on the slide, like talking about the regional variations in Challenge 11 and stuff, because people can just read that. And I'll just add, you know, the bits that are maybe new and
Yeah.
building upon, like that's something I could cut.
And maybe we should just in general kind of keep mentioning, read the report. It's much more detailed than our presentations.
Right. Yeah. Yeah, and I can be more brief on the environment and civil society. Just list the rights, maybe. Yeah.
And then one more question.
Yeah.
I'm hearing an echo. No, it's gone. No, I'm hearing an echo somehow.
Oh, you are? You do too?
Yeah.
No, I mean,
Oh.
I hear some echo, yes.
Oh, I don't hear it. It must be me. But I have headphones in. I wonder. I can change to my AirPods. Should we see if that makes a difference?
Maybe. Now it's gone.
Or let me. Oh, it's gone.
Now it's gone. Weird.
Now it's gone,
I don't
yes.
know. Yeah.
Okay.
Weird.
Because I'm using the same thing as yesterday. The AirPods always die before the meeting's over,
Yeah,
so I've abandoned
true.
them.
True.
Yeah.
I was gonna ask because people were asking for the slides yesterday in the chat.
Yeah.
Should we already share the slides in the chat, or do you want to wait for after? We hadn't talked about it yesterday, so I didn't want to put a link to the slides in the
Right.
chat already.
Yeah.
But
I mean, I'm okay with it. Would it be just the OneDrive link, or it would be like you have somewhere that they can't edit it?
no, it's a PDF version of
Yeah.
our slide.
Yeah. And it has the notes too, or no notes? Just
No,
the.
just the slides.
Yeah, that's
Let me
perfect.
double check.
I think that's fine because even in the Microsoft Teams meeting, they can, if they, you know, have, I don't know, the most recent version or whatever, they can click back and forth. So it's sometimes nice to give them the option to like see if they missed something on the last slide to be able to navigate themselves. So for me,
Yeah.
that's no problem.
Okay, then I'll just post a link down in the slide when someone asks.
Okay, yeah. Yeah, cool. And you'll email it out as part of
Yeah,
like,
I can.
yeah.
I'll email it afterwards to everyone, so
Yeah.
the people from yesterday have it as well.
Yeah. Okay, cool.
But yeah, no, I was just double checking with the slides. It's just the slides, no notes.
Perfect.
And this is the.
Not that there's anything in the notes, but it's just they don't need to see all of them.
Yeah, no, of course.
Hey, Ghana.
Hi.
Hi.
We need to agree with
Hello.
Augusto. Are you presenting only HIV and hepatitis, so one challenge, or you want to present more?
I can present one since you are better in English than me.
Not sure.
No,
We
you're
just
both
have
good.
different accents.
I am sure.
None of us have the good English, but we have different accents. I have Slavic, and you have some Portuguese.
I'm Portuguese, Russians.
So then on the challenge 5, so I will present 3, 4. Then you have challenge 5, and then I'm back for 6, 7.
Okay.
And we'll try
Sure.
to be shorter than the last time. I understand that I took too much time.
No, I mean, we were all just saying, no, it's not your fault. I took a lot of time too. I mean, we were just saying that we should try, And Augusto is not going to make an intervention from the floor yesterday because I was realizing we actually have 5 for this one instead of the 4. So we still have just the 4. But yeah, we'll try and be a little bit briefer and see.
Not reading the slides, but just highlighting the same as we did in the Vienna, just highlighting the key words which are highlighted.
Yeah, sure. No, that sounds good. And we'll introduce, I think it's me that will introduce you two together, and I'll just let you two pass, like, you know,
Good.
You'll start Ghana, you'll pass to Augusto, I'll pass back to you, and then I'll thank you both. Or I think Mate will thank you both. So yeah. And Ghana, I don't know if you can see, I think you should be able to, if, well, maybe you're not logged in with your VNGOC, but I put the link in the chat for the Google Doc from yesterday in case you wanted to follow along for the flow. Can you see that?
In the chat.
Yeah, it's in the chat. It's the same thing as I emailed you. So wherever you have it is easy, but let me know if you need me to paste it again.
I think Ghana still has access to the VSC Teams environment.
Yeah.
So
great.
I haven't left the join because we were thinking about agreeing on this webinars, but I guess that I will need to leave.
No, I mean this chat in Teams, not our group chat, not our WhatsApp group chat, but just right here in the in the Microsoft Teams.
Should see it.
I know I'm not ready for you to leave the WhatsApp. Great.
Sorry for being a little bit late.
Hey, Mate. How are you?
Hey.
Hi, Mateo.
I had to prepare myself because as soon as we finish with the webinar, I'm already in my car and on the way to.
Oh no.
So I will be a little bit in hurry at the end. So.
No problem.
12:30 we have to finish.
Yeah, we were just talking about how we can try and be a little bit more brief in each of our sections to give more time.
Yeah, that was also my observation yesterday. Don't go too much into details, please.
Yeah.
It was a little bit too much details, and we failed to give people a chance to speak.
I hear you, Mate. I understood that it's stone in my garden. It's clear.
Don't go into too much details. No need to explain specific interventions. Just be general.
Yeah. And we'll only have, we had some updates, Mate, to the floor intervention. So Carolina, she had her friend's dad died all of a sudden. So she's not going to join us live. So we'll just use her video again. We made sure we did a tech check because I don't know if yesterday you noticed Carolina's video wasn't working, just the sound was working. But we did a check and it's working. And Augusto is not going to speak from the floor. He didn't have a statement, so we're not taking that away from him, but also just for time, he was happy to kind of just have the 4 from the floor. So it's the same as yesterday, except Charity is speaking instead of George. So I just updated I have the same document as yesterday, and Sarah put it in the chat. I put it in the chat too. The Google Doc with our flow. So I just updated it accordingly. And yeah. And Augusto and Ghana split up their slides too. So they're going to just switch between them. I'll just introduce them both and then you'll thank them both, but they'll go between themselves. I think that was all you missed.
Okay. And also based on the discussion in the chat, I noticed that some people were quite unhappy with, so my suggestion is that we have to balance as much as possible different areas of work. Also to mention as much as possible recovery, prevention, treatment, not so much focus on harm reduction because it was a little bit too much of it.
Oh, really? I couldn't see a lot of the chat. I was just saying at the beginning, I've had chat problems.
Yeah,
so I couldn't even read a lot of the chat.
The most intensive discussion was about this, that was too much focus on harm reduction and it should be more said about other areas because I think that there is a lot to say also regarding prevention, recovery, treatment in each challenge. So please try to be as balanced as possible.
Yeah, of course. Okay, that's funny. I didn't notice that.
I was very polite and good yesterday.
I know. Oh, when you were replying to people? Oh, good.
I was very, very balanced. No, that's important discussion. Where it would be good to have because saying like our LGBT people saying now everybody is speaking about funding harm reduction, but we need to speak about funding LGBT programs. And my argument is, guys, it's not enough. Health budget is so limited. And all the compendium from prevention to treatment and recovery is so under budgeted that trying to take one piece from harm reduction to prevention, it will change nothing because harm reduction is also very underfunded, even though we are speaking about this, but it's really in the crisis situation now. So it's better to tackle the law enforcement to get the budget because
absolutely.
Security and law enforcement now the kings in the funding. And nowadays with the wars and with all of the security issues. So I was trying to be polite, honestly.
Oh, good.
And
well, I'm glad you were
balanced.
replying to people. Yeah, because we weren't able to pick it all up in the conversation. So that's great that you were active in the chat. Thanks, Ghana.
I think we should focus is support the human beings, doesn't matter what they are.
Yeah, of course.
Then we have the LGBT, the TOBGT, the IGT, and all these things, and in the end, it's all human beings. So,
should I start letting people in? So we have. Oh, I have an echo again.
Oh, there is. Oh no. Does anyone else hear it? I can't hear it anytime. It's still happening, Sarah?
Is it still
Maybe
happening?
we can just mute when each of us aren't
No,
speaking.
okay.
Oh, it's over?
It's okay now.
Yeah?
Yeah, it's weird. Okay, I'll stop letting people in if that's okay.
Yeah, I'll just confirm, Mate, you have because I don't see you in the document. I don't know if you printed it yesterday and you were using a paper copy, just because I updated a couple things to reflect what's changed for the Google Doc with the order.
I have the same papers.
Oh, okay. But you printed it?
Yesterday.
Because I made some little edits. I don't know if you want to look at it live. I mean, it's not a big deal. It's like Carolina. I cut Augusto. So some of the things at the end have changed. So I don't know if you want to look at the Google Doc too and have that open to see any of the differences. But
okay, so Augusto will not speak and Carolina will have a video recording, right?
Yeah. So at the end, instead of it going to, it's just the same as the first day pretty much. Because before we had an extra of you and me swapping back and forth. So you'll thank Charity and then introduce Marie, and then I'll thank Marie. Hopefully there'll be a Q&A and I'll pass it back to you to close.
So that's the same.
as yesterday, but it's different than what it says for today. Because it said that you were going to then introduce Augusto, and then I was going to thank everybody at the end. There's just a little difference at the bottom.
Okay.
Yeah.
Okay, letting people in now.
Please, thank you.
We'll manage. If I'm confused, just correct me.
No, you'll be good. Hello, everybody. Thanks for joining us. We'll just give it a couple minutes as we let people in.
Hello, good morning, good evening.
Wherever you are.
Zones.
Yeah.
Good afternoon. Good afternoon.
Oh, good afternoon, Augusto.
I think we can go ahead and start.
Sure. Thank you so much, Sarah. Hello, everybody. Welcome to our webinar today. My name is Nazli Maksudi. I am the chair of the New York NGO Committee on Drugs. Really happy that you're all here, welcoming all of you. Our webinar today is focused on the Global Civil Society Report that we prepared across the Vienna and New York NGO committees as a contribution to the midterm review of the CND, which of course took place just this past March, but it has lots of relevant findings for the next 5 years and long after that we're really pleased to be sharing with everyone today. So really happy to be jointly convening these webinars across the New York and Vienna NGO committees and to be co-chairing with Mate today. I'll allow Mate to introduce himself now and take us through some technical details before we get started. Thank you.
Hello, everybody. Thanks for coming to our webinar. My name is Matej Košir. I'm chair of Vienna NGO Committee on Drugs, and I'm co-chairing this webinar together with Nazli. It takes some time to organize this webinar. We promised at the CND already that we are going to organize it to disseminate a little bit more our global report, which was prepared for the midterm review. So we are now doing this, organizing 2 webinars. One was yesterday for different time zones, and this one is today. We are trying to get new momentum with this global report and the implementation of the ministerial declaration. There are several conclusions from the report, and we will definitely work on those conclusions in the next 5 years. Let's see if we can improve as a civil society the situation, at least in our sector, regarding drug situation globally. Before we start, there are several technical issues to highlight. The webinar will be recorded, and we ask you to mute yourself when you are not speaking. There will be no interpretation today, so it will be only in English, unfortunately. You can see the agenda in the chat, so you can see what we are going to talk about and what kind of topics will be discussed today. You can use chat. You can raise hand to ask questions or make comments. We will try to follow this on chat and Q&A. And we will try to give you as much space as possible for your also asking questions live, and also giving some comments and responses and feedback to what will be said during the webinar. We will also have these slots for questions and answers between, not just at the end. After each slot, we will give an opportunity to you to discuss and ask questions. But in the meantime, you can always use chat and put your questions and comments there. You know, only we will speak only about the selection of points today because our time is limited and the global report is quite extensive. So I would strongly advise you, if you didn't do it yet, to read the whole report, and the link to the report is also published in the chat. So please, Nazli, the floor is yours, and we can start with the slides and the content of the webinar. Thank you.
Thank you, Mate. Wonderful. So if I can ask Sarah to begin sharing our slideshow, we'll get started. Wonderful. Thank you so much, Sarah. Okay, so we can go to the next slide. The first thing I'll just cover today is a little bit about the methodology and the process that brought us to the publication of the report. So last year, we entered a joint agreement between the Vienna and New York NGO committees on drugs to work together as equal partners in order to ensure the broadest and most inclusive civil society engagement for the 2020-24 review. And that was really building upon the success of our past cross-committee collaborations. Many of you may be familiar, for example, with the Civil Society Task Force. Since that announcement, we held extensive consultations to gather input from civil society on the progress and challenges in implementing international drug policy commitments. We did a global online survey that resulted in inputs from civil society around the world, and we also hosted 4 regional consultations, namely for the Africa, Asia Pacific, Europe, and Americas regions. Then we took all of those inputs, as well as civil society statements that had been made at the thematic discussions from 2019 to 2023, and we summarized those all in a global civil society report, which we then published together as a written contribution to the midterm review. We're really pleased to be presenting that today. It's an important input from civil society for the midterm review and beyond. We've also put a QR code here on the slide if that's an accessible way for you to access the report as well, if you haven't seen it already. So let me pass it back to Mate to cover some respondent characteristics and an overview of their perceived work and progress on the challenges. Thank you.
Thank you, Nazli. I think it's also important to highlight that we got some financial support and some other support from some member states, because all of this wouldn't be possible without some donations. So thanks to Portugal and Slovenia and also some other member states, United States and other partners, which gave an opportunity for us to organize this quite extensive consultation process. So thanks to them, this is also a result of this support. And as you can see from the respondents' characteristics, most of respondent NGOs were relatively small NGOs operating on a national level. So we really got information and feedback from the ground, from those who work with our target populations. And also a majority of respondents who contributed to the report identified as directly involved in service provision to people who use drugs and other community members. And respondents indicated that their work focuses predominantly on the fields of health, education, human rights, based approaches to address drug-related issues, with prevention, harm reduction, and human rights being the most mentioned. But it doesn't mean that also other NGOs from treatment and recovery and some other fields like access to essential medicines, they also contributed a lot with their input. So report is quite comprehensive. It covers many different topics, and I would say all topics which are relevant for civil society organizations are addressed in this report. Some of them less, some of them more, but everybody, all civil society organizations and member states and also other stakeholders can find something useful and valuable for their work in the report. So I would strongly recommend that you read the report and try to find something which you can use in the next in the near future for your advocacy activities and improvement of services. So next slide. Yeah, we also asked respondents and participants in the survey to assess the situation about the progress or regression. So we have quite interesting information. So we can always build on this assessment and try to improve situation regarding each challenge. So we will go through each challenge now, so you can actually see challenge by challenge what kind of progress civil society organizations think it was made, or if there is some regression or some what they do to improve the situation. So please, I would give the floor to Sarah to present first the first lot of challenges, which are supply reduction related challenges. So you will see about the progress or regression or activities by NGOs in each challenge. Thank you.
Thanks, Mate. Thanks, Nazli. Yes, I'm going to quickly walk through the supply-related challenges 1, 2, 8, 9, and 10 in the report. In the interest of time, I will not focus on each of the challenges individually, but rather kind of skip through some of them, so we have more time for the health-related and human rights-related challenges later on. So with that, let's take a quick look at challenge 1. For each of the challenges, you will see on one side of the slides the responses in terms of whether people saw the challenge progressing, regressing, or neutral. And in the case of this challenge, people did see some progress across all regions, especially highlighting the expansion of drug checking services and expansion of early warning systems to tackle the expanding and diversifying range of drugs and drug markets. But unsurprisingly, a lot of challenges were also encountered, and people specifically mentioned the severe impacts on indigenous populations, LGBTQIA+ communities, and other communities facing socioeconomic inequalities. Also, the sole focus on supply reduction on the supply reduction side was seen as a challenge by some, and the need for more health-related interventions spanning the whole range of interventions from prevention, harm reduction, treatment, and recovery was highlighted by many. In that vein, also the responses from NGOs to tackle those challenges were quite similar, spanning the whole spectrum, mentioning particularly the need for producing harm reduction materials for new substances entering the markets, and the need for prevention programs for young people. Challenge 2 also saw some progress made, especially in terms of increased regional cooperation, responding to the record levels of drug abuse, illicit cultivation, production, and trafficking. So there was no consensus. Some cited experiments in regulating the legal cultivation of cannabis as promising practices, and also alternative development schemes that take into account the whole supply chain were attributed to progress made. This was also part of the interventions made during the CND thematic discussions and also came up in the regional consultations. Challenges accounted, one that we hear very often, and we'll hear from other challenges as well, is funding constraints to implement any intervention, and the stigma and discrimination people face. NGO responses mainly focused on awareness and education campaigns and advocacy for decriminalization, and responsible legal regulation. We'll hear more about that in later challenges as well. Challenge 8, 9, and 10 focus more on the criminal side of drug policy, with the increasing links between drug trafficking, corruption, and other forms of organized crime in Challenge 8, the repurposing of assets in Challenge 9, and cybercrime in Challenge 10. So I will skip through this a bit, mainly saying that collaboration between stakeholders and between different stakeholders and networking on regional and international levels was one of the main responses that NGOs said that they were doing to tackle this. Challenge 9 was not unexpectedly one where we didn't receive as many responses as for other challenges, but there was the mention that confiscation of assets does not always seem to be an effective deterrent scheme when it comes to confiscating proceeds of crime-related money laundering. In regards to Challenge 10, one of the most mentioned NGO responses was providing evidence-based drug prevention, harm reduction campaigns, and services in cyberspace. The challenges encountered were mostly around the misuse of communication technology, misinformation, fake news, including state censorship. And with that, I would give back to Nasli for the next set of challenges.
Thanks so much, Sarah. I really appreciate you taking us through those supply-related challenges. We're now going to go through some health-related challenges, and for that, I'm really pleased to introduce Ghana and Augusto, who are both former and current members of the Vienna NGO Committee on Drugs board. So over to you two. Thank you so much.
Thank you, Nasli. And actually, with the health, we will go to the challenge 3 first of all. Next slide. And here they will be about the non-medical use of prescribed drugs. And actually what we see as a progress, it's more overdose prevention measures, access, and more flexible response to the COVID pandemic. And actually with the challenges, but despite all effort of all civil society and harm reduction programs and prevention programs, educational activities which NGO is doing, we still have challenges with the overdose deaths. So and transition to synthetic drugs introduced new challenges in these problems. Especially American consultation took a lot of effort to discuss what works, what doesn't in the North America opioid crisis response. And Africa was speaking about the impact of tramadol in Africa. So we need to work more on this. The next challenge is also about the partly next slide, overdose. That's about the prevention of drug-related death, and we all understand that the good progress, even with the good progress we are doing in the access to naloxone or take-home methadone or understanding by police and medical doctors the Good Samaritan law to prevent the deaths, first of all, and understanding of gender-sensitive health services, we still have the challenges with human rights abuse, with the insufficient funding for health prevention, treatment, recovery services, disproportionate focus on law enforcement measures. And yes, NGO is working all over the globe to have the proper response and sometimes to compensate the absence of state-provided services. That's why we're doing advocacy. And for the next challenge, I will give floor to Augusto.
Thank you, Ghana. So the challenge number 5 actually is the second one with a more high response in terms of positivity. So we have around 47% of the response. They were positive in terms of progressing. Acknowledge the progress in addressing the challenge of high rates of transmission of HIV and hepatitis C and virus and other blood-borne disease associated with the drug use, including drug use in some countries. So it's a kind of a thing that accessible and affordable prevention, harm reduction, testing, diagnosis as progressing, as well treatment and recovery service being offered. So there's some positive response in the European on the European regional consultations. They also observe advancements in tackling the high transmission of HIV and also in reducing the stigma among the HCV and the HIV, and also improve the treatment also with the new medicines in European. Also, there's positive responses. Some services that are being implemented to the sex workers with the innovative models in the New Zealand rehabilitation programs in the prisons. So it's been showing some progress on this factor. Also, there's a decline in HIV and HIV among people using drugs. For instance, in Macau, since 2016, there's no new infections among the people that inject drugs due to the needle syringe programs. And also, in some countries, there's successful implementation of the PrEP programs available for men having sex with men and people who use drugs. There's some challenge. The common challenge always the lack of funding. That is the common challenge that we can find in all the challenge. Some other ones saying that there's absence of comprehensive prevention and harm reduction service, limited access to control medicines for pain relief, limited HIV and HCV testing for people who use drugs, and also criminalization, racism, and discrimination against Indigenous, Black, and Brown people results in people from these communities disengaging from or actively avoiding health service. So there's also a mix between what being progress and also some areas is not having some the progress that we should have. And 66% of the NGOs, they respond that they are working on these. 65% actually of the NGOs response to the survey that they are working on this challenge, trying to improve the challenge that we saw before. And also there's some good feedback from some NGOs regarding the mobile outreach programs, mainly in Lisbon, highlighting the importance of screening for drug-related infectious diseases like HIV. So, in somehow, it's been the positive among 47%, but also we can see there's a lot of work to do. Thank you, and Ghana, back to you.
In the next slide, we have the 6th challenge, and in this challenge, we are speaking about the changes in the drug market and response to the health consequences associated with new psychoactive substances. And here it was highlighted the importance of the quality early warning system, and it was recommended to use it more. And also, civil society said that we're really developing the good civil society-led drug checking services and the services which help to prevent death and overdose from NPS. But among challenges they also appears there are not enough training to address health risk and overdose caused by NPS use. It's not enough outreach and proper digital outreach to harder to reach population and youth. And the new prohibitions create new challenges to approach youth. And what is important achievement of NGO we need to highlight, it's the capacity building and training for health providers and psychologists. the increased evidence-based prevention and including this and developing prevention curricula training programs for communities and schools, and harm reduction services, including drug checking and safer supply, and minimize health risk for people who use drugs. Next challenge, the seventh challenge, it's about medical use and medical and science use of psychoactive substances. And then next slide. Here we need to say that there are a lot of progress made, and some civil society activists identify the progress, especially in cannabis-based medicine access in 18 countries, and in the more scientific research on the using of psychedelic substances for various illnesses. But we still have challenges with the difference in availability of opioids for pain management and palliative care between high-income and low-income countries, and also we identified from the different discussion the appearance of opioid phobia among a lot of countries who are afraid of manage, procure, and make the effective programs of the medical use of opioids. And civil society from all around the consultation emphasized the need of proper research, data collection, and analysis, and including documenting treatment effectiveness. And for the NGOs who are working in this area, the organizations advocating for availability of prescribed pain management for patients, and facilitate. Also, NGO is playing key role in access to opioid agonist treatment and pain management opioids and other psychoactive substances in situation of humanitarian crisis, war, and the hostility repressions, because NGO as a frontline responders to the any health and social needs of people they're serving, they are delivering vital services, drugs, even with the risks to their lives. And there are in report, there are several examples, including Ukrainian one. And here I will stop and pass back to Mate.
Yes, thank you, Gana and Augusto, for presenting health-related challenges and some progress and challenges which are still in place, and we have to address them in the next period. So yeah, we will, after this 2 slots on supply and health-related challenges, we have some time for questions and answers. So I see that some of the questions were already answered in the chat, and there is no pending questions there. So please raise your hand, and you can ask question or comment live. So we can wait for a few seconds more, so you can raise your hand. And I know that everything was clear from the report from our speakers, but still I believe there are some questions. No? Then we can proceed. So all the questions were obviously answered by speakers. So thank you very much again, Gana and Augusto. And I would like to pass on to Nazli again to present also some challenges and progress related to human rights and emerging trends challenges. Thank you, Nazli. The floor is yours.
Thank you, Mate. Yes, so I'll be taking us through challenges 11 and 12, which are, of course, on human rights and the conventions, as well as data. And then I'll take us through some of the more general comments that were made about progress and challenges and emerging trends. So starting with Challenge 11, which is of course about the non-compliance of responses with international drug control conventions and human rights obligations, some of the different respondents and participants really address these issues together, whereas others address these separately. But there was a recognition that non-compliance with the international drug control conventions is often linked to non-respect of human rights of people who use drugs. So there is this kind of intrinsically related element of what might be seen as two separate aspects of this challenge. Now, I'll take us first through the non-respect of drug policies with human rights obligations. And you'll see that on the slide, we've listed a number of different human rights that were raised by participants and respondents as being often contravened due to drug control policies. I'll give some specific examples of the ways in which the human rights concerns were described by our respondents. So these include things like the criminalization of people who use drugs, as well as those at the lowest levels of drug trafficking, the use of capital punishment, as well as extrajudicial, summary, or arbitrary executions for drug offenses, the use of compulsory treatment for drug dependence, the insufficient access to health services, including evidence-based prevention, harm reduction, treatment, and recovery services, as well as insufficient access to controlled medicines, and the stigmatization and discrimination against people who use drugs, including those in prisons and other places of detention or closed settings, and their further marginalization on the basis of race, gender, class, and age. Now, we did also have some other human rights that were raised beyond those listed here on the slide. For example, particularly among respondents from Latin America, there was the emphasis on ensuring a safe, clean, healthy, and sustainable environment in order to respect, protect, and fulfill human rights, recognizing that drug control measures were seen as posing a challenge to the climate crisis. Another challenge that was raised with respect to human rights was shrinking civic space, the idea that this creates barriers and challenges for civil society and undermines several human rights, including the right to freedom of opinion and expression, rights to freedom of association and peaceful assembly, and has sometimes led to the closing of life-saving harm reduction services, which of course undermines the right to health and the right to life, among others. Now, many expressed support for proportionate sentencing, decriminalizing drug use and possession, ensuring law enforcement efforts are consistent with human rights obligations because there was concerns raised about racial profiling and targeting by police of marginalized populations. And this includes a wide variety of different groups such as indigenous peoples, peoples of African descent, migrants, racial minorities, and youth. There were some also that were recognizing other important instruments in international law as well as guidance. So the UN Declaration on the Rights of Indigenous People was raised, the Convention on the Rights of the Child came up. There was also the international guidelines on human rights and drug policy that were seen as important, the UN System Common Position, as well as some recent resolutions from the Human Rights Council and a report that was published quite recently by the Office of the High Commissioner for Human Rights that was about human rights challenges in addressing and countering the world drug problem. So with respect to that kind of thinking, there was also a need identified for further collaboration across UN bodies to ensure that drug control efforts do not undermine human rights and the Sustainable Development Agenda. And some suggestions to that respect were having a standing agenda item at the CND, for example, that can address the human rights impact of world drug policies, and also a standing chapter in the World Drug Report that can address human rights as well, which would be informed not only by UNODC, but also other relevant UN agencies and bodies. So now moving on to non-compliance of drug policies with international drug control conventions, some different folks shared their perspectives on the legalization and regulation of cannabis for non-medical and non-scientific purposes. Now, some believe that these approaches were in conformity with the conventions by upholding their overarching purpose of ensuring the health and welfare of humankind, but others maintain that such approaches really went beyond the flexibility that was offered by the conventions. But across these different perspectives, there were really concerns related to the challenge of commercialization of cannabis and corporate capture. Overall, while there was no consensus, some did think that there should be more open discussions at the international level on this changing reality of national policies for cannabis, in hopes that that would help to ensure that such policies would be aligned with the UN pillars of human rights, development, and peace and security. And without doing so, that the international system could become obsolete. And lastly, on that bit, there was also some welcoming the World Health Organization's critical review processes for cannabis, as well as the ongoing and forthcoming such process for the coca leaf. Now, we had many different folks indicate that their organization works on this challenge, and there were a wide variety of activities, as you can see on the slide. But I'll just flag that there were some who conducted research and advocacy, and others that were specifically documenting human rights violation and trying to provide legal support to affected populations. So with that being said, we can move to the next slide, which is about Challenge 12. Thank you. Now, this was on the topic of geographical coverage and availability of reliable data on different aspects of the world drug problem. It was not selected for the CND thematic discussions, despite being, of course, in the 2019 Ministerial Declaration. And for that reason, we didn't specifically ask folks about this in our online survey. That's why you don't see that beautiful bar graph that appears for all the other challenges for this one. But nevertheless, different respondents in the survey and the consultations did highlight aspects relevant to this challenge. So we wanted to underscore some important points that came out of that today. So those that raised this point did talk about the need for more reliable, comparable, detailed, and verifiable data that demonstrates the magnitude of drug-related problems and trends, especially for vulnerable populations and in rural areas. Some also identify challenges related to a lack of detailed and comparable information in official international or national drug reports, a lack of data too on evidence-based prevention programs in several countries, and the flawed implementation of international prevention standards, as well as inadequate access and coverage to treatment, harm reduction, and recovery, especially among girls and women. There were also some global initiatives that have been launched by civil society and academic community folks that were really about additional indicators such as human rights and the harms and consequences of drug use that should be included when we're evaluating how we're doing on the world drug problem. And one example of a resource on that is the GDPI, or the Global Drug Policy Index. Now, moving into some of the more general progress, challenges, and trends that were raised by respondents. With respect to progress, there was a recognition that civil society involvement and collaboration had improved in a number of settings, increased involvement of people who use drugs, people in recovery, other affected populations like farmers, youth, and indigenous peoples was recognized. Also, the reality that the CND proceedings are now being broadcasted and archived on UN Web TV was seen as a win for civil society participation, as was the inclusion by member states of civil society on some of their delegations to the CND. With respect to other progress, some identified the establishment of standards in the fields of prevention, treatment, and recovery, although they did note the lack of a corresponding challenge specifically for the area of prevention and recovery as a shortcoming of the way the international discussions and instruments have been structured. Now, others noted the expanding harm reduction approaches as a positive development. They were an identification of supervised consumption services, drug checking services, as has come up, and folks were really pointing to global public health crises, particularly the overdose and drug toxicity crisis in North America. Some, as a result of this, really did call for the need to include harm reduction explicitly in language adopted by the CND, which of course did happen for the first time at the most recent session. And there was also a calling for more innovative approaches. So one such example is safe or safer supply initiatives, which, just to explain what that is, that's the lower barrier provision of regulated drugs to reduce fatalities that are associated with a contaminated and unregulated drug supply, which is, of course, the underlying driving factor of the overdose and drug toxicity crisis in North America. One last element of progress here that some NGOs did highlight was the legal regulation of certain drugs, most prominently cannabis, seeing this as opening the debate and the initial results of those frameworks being positive. They stressed that this allowed for a breaking of the linkage between drug markets and organized crime, and many did point to the recommendation made by the Office of the High Commissioner on Human Rights in their recent report on human rights and drug policy from 2023 that called for the consideration of legal regulation on drugs as a recommendation. But this was certainly not a point of consensus. There were also several NGOs that were really pointing to legal regulation as a setback. Now, moving into some challenges, we did see that several respondents across all regions observed that while the discussion on drug-related issues has shifted, this has not concretized into policy changes at the national, international levels. There was what was perceived as a lack of political will to really reform legislative frameworks in order to reflect changing issues, realities, and positions and responses that are proving positive. Now, particularly in the fields of prevention, harm reduction, treatment, and recovery, respondents highlighted the need for more indicators linking back to that data challenge to measure progress in policies and practices. And there was also the need for introducing respect for human rights as an indicator for the evaluation of drug policy as well. Folks also were directly affected by war and armed conflict, as has come up already, but they really did continue the provision of services and life-saving assistance to people who use drugs in those challenging circumstances. Some also did identify poor cooperation with government and a lack of safe space for civil society to act due to threats from officials as well as criminal groups involved in drug trafficking. Now, another main overarching issue that was related to all challenges in all regions, I think we can all relate to this, is the lack of sustainable funding for NGOs, particularly prevention, harm reduction, treatment, and recovery. And some also pointed to the misallocation of resources, with health budgets being diverted to other sectors like the military and law enforcement, and the need for really more of an emphasis on health in drug policy type budgets. Now, just to highlight a few trends that did come up, there was an increased engagement of UN human rights bodies in these discussions, particularly to align with the 2030 Agenda for Sustainable Development and promote human rights, development, rule of law, and peace and security. And some really did emphasize the need for more UN guidance in order to ensure that legal regulation policies that are popping up are in line with health, human rights, and development. There was growing calls to put racial justice, equality, and non-discrimination at the center. Criminalization of women and youth under the pretext of violence associated with the drug trade and law enforcement was also emphasized as a trend, a concerning trend. And another pressing concern that was highlighted was the need to decolonize the drug control regime. So a recognition of the inherent tensions between the drug conventions and the rights of Indigenous peoples, with the recognition of different systematic threats and violence against Indigenous leaders who are working to protect their communities and their habitats, and as well the need to recognize those environmental harms that are associated with drug policy. And lastly, here, some NGOs underscored the critical importance of tackling the root causes of drug-related challenges. Those include poverty, inequality, and limited access to education and healthcare. So I'll leave it there. Thank you so much for your attention.
Thank you, Nasli, for a very extensive presentation of related of those challenges. So we again have some time for questions and answers. There is one in chat. It is the following. So did any respondents make suggestions on what they see as the best opportunity or platform for international and domestic discussion on the International Drug Control Access Conventions, interpreting the rules and reforming the system? So do you remember, is there any specific recommendation or suggestion? Ghana, yeah.
Actually, there were plenty of recommendations from civil society that we need to emphasize the advocacy toward the national agencies and to be to be partnering with the national agencies between different NGOs. But there were not specific platforms. In one of the respondents, they were mentioned, and we had in the 7 challenges, that if the civil society build in the broader platform to advocate, that works much better toward coordinated effort works much better. But there were no specific recommendations which platform or opportunity in each country. We are very diverse between the regions. But I need to say from my side that those organizations or platforms who organize the consultations, they could be used at least regionally as a sharing good examples. First of all, Vienna NGOC, New York NGOC, but also in European countries, our partners were Civil Society Forum on Drugs, also the platform to work together to advocate to the on the European drug policy. There was the African Civil Society Forum on Drugs just formed during these consultations, and Vienna NGOC have the regional consultative groups and platforms for the Asia Pacific and for the other regions. And I guess the in America we have also this platform. So at least for regionally, we are playing this role of the coordinated effort and sharing the experience.
Thanks, Gana. I'll just add on to that too. Just that I think that certainly those platforms are very relevant, and I recognize or remember that particularly I think of our respondents, the main kind of international forums that they were engaging with was certainly the Commission on Narcotic Drugs. So folks applying to the different speaking opportunities that come through our 2 committees and showing up to the CND primarily at the annual session in March, but also at the reconvene, the intersessionals, to use that as an advocacy opportunity on these issues with member states and UN agencies, but also as is perhaps linked to some of the content that I shared, increasingly trying to do that type of engagement in other forums as well, such as the Human Rights Council. Certainly in New York, we do engage at the General Assembly. We've had an increasing number of resolutions beyond just the omnibus resolution that was happening annually, is now every other year, but we had the recent synthetic drugs resolution from the US. There's another one on Central Asia currently going through. So it's becoming an important platform or area for organizations that are working on drug policy to intervene. And Mate will speak in a little bit about the Summit of the Future too, which is of course another New York based opportunity to raise these drug-related issues and concerns. But yeah, that's the last thing I would say. And I see a question on Challenge 11, Mate. Should I reply to that too in the chat? Yeah, just about it. Oh, Mate, you're muted. Yeah, is that okay?
Yeah, it's more like I see it's a question mark, but it's more like a comment. But you can respond. Yeah, you can respond.
Sure. Yeah,
No
just
problem.
until people put their hands up, I can respond to that too. That Challenge 11 non-compliance, is that related to obligations for access to medicines, I believe is what the intention there is. And certainly that is, as part of that challenge, there is the element of human rights obligations and access to medicines, whether that be for palliative care, whether that be for harm reduction, for treatment. Those are all an essential part of the right to health, the right to life. So absolutely, that is an important piece that did come up under Challenge 11. Thank you. I hope folks will raise their hands, not only with questions, but with comments, maybe things we didn't say, maybe things that you remember putting in your responses or saying at regional consultations, or even that you didn't say, but you wanted to raise. Please do. We'd love to hear from you.
Okay, yes. At the moment, we don't have any hands up or question more. Oh, yeah, we have. Good. So, Pastrana.
Yeah, Tanya. Hello.
Yeah,
I was with a
please.
question. I work in palliative care in the International Association for Hospital and Palliative Care, and I thank you very much for the report. I wonder if the I would say minimal report on the access, the world problem that we have with the access, is because the civil society haven't participated of that. Is our guilty, or your interest is much more in the other aspect of the access to medication like harm reduction, etc., which is also very important. But that is just one point, and we have a lot of problems from the formulation, from the regulation, from the education, a lot of problems that's and here I can see the really need that people have, the really pain, the really suffering at the end of life that happen, and it is just so well. I wonder if it's or if we have to be much more involved in this report or something like that.
Actually, I'm very thankful to your comment because I was responsible for putting this report on Challenge 7, and I was putting all my effort to find out everything from survey where there are the concrete challenges and responses. Don't look in the slide because in report it's more said about the palliative care access and needs, and that's actually it's not enough, we all understand, but it was only one challenge and we were limited to the pages, so we could not pay attention to each of the topic such properly as we wanted. And all materials which were provided during the intersessional and during the speeches from intersessional speakers and during the online survey and discussion which we had in European in all the regions, I was trying to put, and we were trying to put and to get as much specific as possible, but the limitations are very high to the length of report and to possibility to be deepen in one or two issues. But we all understand. Actually, that's what I've heard from the participants of the consultation, that we all understand that palliative care and access to medicine for palliative care is one of the priority which we need to concentrate and to work together in formulating more carefully.
And maybe if I can just add on to that too, Sarah, if you can take us to that, I think it's the third or fourth slide that shows the overarching table of how many CSOs were saying that they were working on this issue. This might also be relevant to your question here. Yep, just the next one, the one that you were on with the table. Thank you, Sarah. Under Challenge 7, you can see that 34% of NGOs in the global online survey did say that they were working on this issue of low availability of access for medical and scientific purpose to internationally controlled substances. So it's not the lowest. You see that there's some that are lower. Certainly some of those money laundering, corruption challenges had lower responses, but it's not as high as some of the other things. So I think you're right in terms of your interpretation that where civil society has emphasis, this is really seen as an important issue across, I think, but it's not necessarily the highest ranked here in terms of what NGOs are working on themselves. So I think always an area for more civil society engagement and NGO involvement, leading from the kind of expertise that your organization and others that have been working so diligently on this issue can guide us towards. Thank you.
Okay, shall we proceed? There are no, I think the question from Myrtle, I think Sarah can answer it, or I can just mention that we are still in the process of developing this statement from Impact Coalition, so it will be published or sent to members as soon as we finish with this process and finalize the document. So it will be available to everybody, also to comment and also to address some additional issues and propose some concrete actions. So it is in the process and it will be communicated to all members. So yeah, let's move on, and quite substantive piece of work was made on the topic of the way forward, because this is actually the purpose of this report. So we tried to highlight some ideas, some recommendations for the future actions based on the analysis and assessment by civil society organizations, and we actually came out with 6 key conclusions There could be more, but we try to summarize as shortly as possible. So we focus on the most relevant and the most I would say those who are the most frequently mentioned in the consultation process. So the first one is definitely covers all areas of our work, and it's related to capacity building. So there is a recommendation that we should invest more in capacity building and comprehensive public health training, and that's not only among civil society organizations, but in general, also in other sectors. I think it's important and relevant that we build capacity and provide some comprehensive public health related training. The second one is also very important, was mentioned several times in our consultations, so that we should invest more in evidence-based interventions, prevention interventions. So we still know from our knowledge and also based on the discussion, there are still many ineffective or harmful interventions implemented around the world. So this is also one of important recommendations, especially because we have also UNODC WHO international standards in the field of prevention and some other relevant documents which could help us to improve this situation. The third one is also extremely important. So we have to improve access to harm reduction, treatment, and recovery services. So in many areas, in many regions and communities, we have limited access to those services. So we have to do our best to improve this access to the services, but not only to harm reduction, treatment, and recovery services. Also was mentioned access to essential medicines. Also fits to this recommendation quite strongly. The fourth is very important, is not directly related to drug use, to drug situation, but indirectly and very strongly related to our topics as well. So we should in the future address a little bit better root causes of drug-related issues such as poverty, structural violence, racism, inequality, lack of access to education and healthcare, which was already mentioned by Nasli. And the next recommendation is that we have to shift our efforts towards health-focused policies and also services rather than punitive measures. So this is also, I would say, quite, I would say, consensus in civil society community that the only solution could be related if we implement and enforce health-focused policies and implement health-focused services instead of punitive ones. The last one, the sixth one, is also very important. It addresses collaboration across UN bodies. So this is also a recommendation from the civil society consultations that we have to enhance and improve collaboration between different UN agencies and UN bodies, especially those working on the international drug control regime and international human rights obligations, placing equality and non-discrimination in the center of drug policy making. But there are several other UN agencies which should also be involved in this dialogue, such as UNAIDS, UNDP, and several other ones, WHO, not to forget as well WHO. So there is still a lot of space for improvements in this area of work. So the next slide. However, since February, when this global report was published, there was a lot of things which have been done already. So we are not waiting for miracles to happen. So we were active in this period quite significantly, and we published a stakeholder contribution to the midterm review. summarizing this report, and also an NGO paper to the 67th session of the CND. We presented this report and conclusions at the general debate of the high-level segment, and also at 4 high-level side events on different specific topics. And we also presented this report and some conclusions at several CND side events, including one which focused exclusively on the report and was organized by Vienna and New York NGO Committee together. We also tried to target several member states. We did some communication already with the member states, including influence their pledges as part of Pledge for Action initiative. And we have to say that several member states included civil society and meaningful civil society involvement in their own pledges. So this was also quite successful advocacy action by our platforms. Also, we try to reach as much as possible civil society organizations. We try to influence also their pledges. And so they use report and conclusions as a substantive content to include in their pledges as well. And you can also check on the Vienna NGOC website about pledges by civil society organizations and how they included these challenges and these specific topics discussed in the report in their own pledges. We also hosted and we are hosting webinars, one yesterday and one today, to disseminate this information, to promote this report as a useful and valuable tool for future activities and advocacy actions. We established also Impact Coalition on the future of drug policy. That was in May in Nairobi. We organized special session and officially established Impact Coalition, which will also be engaged in several activities during the Summit of the Future in September this year. So we will try actually to upgrade our work from the report and try to be active with advocacy activities and implementing different actions, not just before the Summit of the Future and organize something at the Summit of the Future, but this will continue also beyond the Summit of the Future, at least the next 5 years until the next political declaration in 2029. The next slide. So what's coming next? Next, I already mentioned. I will just a little bit shorten and summarize what we are planning to do as part of the Impact Coalition activities. We will try to involve as many stakeholders as possible, not just civil society organizations, but we will try to extend the collaboration also to UN agencies, to member states, academia, to several other relevant actors in the field of drug policy, to work together to organize joint activities and actions before the Summit of the Future, so we can already show some impact from these actions. But especially, we will try to promote and engage different stakeholders in activities beyond the Summit of the Future in the next few years. So the Impact Coalition will be a platform for more concrete activities and joint actions between different stakeholders in the field of drug policy in the future. Also, we will be present at the launch event of 2024 World Drug Report, and we will definitely promote some of the conclusions and recommendations from the report at that event as well. We know that there will be also thematic discussions in the next few years. So we will include these topics and select speakers speaking about relevant topics from the report and recommendations as well. So we will definitely continue to engage civil society organizations and partners in different debates We also recommend all of you, the civil society organizations, all participants here at the webinar, to use this report as much as possible. Maybe you don't like everything what is written in the report, but definitely you can take something which is valuable for you, for your area of work, and work on that to improve the situation globally regarding implementation of international commitments and ministerial declaration. So we can maybe show at the end of the process in 2029 better impact, improvements, better improvements in implementing those international commitments. So it is also a role of civil society to do our best to improve the situation in the field of drugs. We will definitely invite you to join with the concrete activities in the work of Impact Coalition. You will be informed on time and quite soon about how you can be engaged in these activities with other partners, we will continue to follow and engage in activities held by Vienna and New York NGO committees on drugs. So just follow our social media, follow our website, and follow emails and newsletters from us. And definitely you will have a lot of different opportunities to be engaged in our activities related to the report or not. So next slide. So this is probably it. Yeah, we still have some time before we proceed to different feedback from key partners in this consultation process, especially from regional civil society platforms. We have some time for questions and answers. So is there anything which is relevant in the chat I was not able to follow? So please help me with this.
No problem, Mate. Thank you for your intervention. Yes, we've been following along in the chat and giving some responses. I don't think there's any questions that have gone unanswered there. But if there's anyone else that wants to put something in the chat or raise your hand, and we'll certainly pause between the regional interventions and the International Network of People Who Use Drugs interventions to allow an opportunity for more discussion. So if there isn't any hands jumping up right now, we can perhaps move to our first live intervention. Give it another second or two. Really would love to hear from all of you. Okay. Yeah. All right, then we'll move to our first live intervention from Aditya, which is with the International Network of People Who Use Drugs. I think they're with us live today, so we'll pass over the floor to you and love to hear your reflections on the process and the report and anything you'd like to add today. Thank you for being here.
Thanks, Nasli, and thanks to everyone, and well done to the team putting together this report. It's a wonderful report, and certainly we can use a lot in the future in our advocacy. And thank you so much for giving me the opportunity to speak at this webinar. My name is Aditya. I'm the Advocacy Officer of International Network of People Who Use Drugs. We are the peak global member-based organization of drug using community. And I would like to highlight several issues from the perspectives of our community and networks. People whose lives are most directly impacted should be involved in that relevant policy-making process. But too often, drug policies are crafted without direct involvement of people with lived and living experience of drug use. And this often happens because of stigma and discrimination against us, against people who use drugs, where we are deemed as unfit or as irrational actors. But we can't continue to accept this as the status quo, and it's not possible to understand the full range of impacts of current or proposed policies without meaningfully consulting with people who use drugs. For instance, our community-led research on drug policies found that purportedly well-regarded decriminalization models did not go far enough, as the threshold amount was too low and it didn't prevent exposure to violence. Similarly, use of fines in decriminalization models are counterproductive as they only serve to punish the poor. And additionally, you also need people with living experience to understand what is a volatile drug market, where patterns of use, drug use and consumptions are changing all the time. And equally, there's no movement that doesn't have people most directly impacted at the forefront. And our wish is to get to the point where it's seen as equally unacceptable to have non-drug using peers representing people who use drugs, as it is to have only cisgender men making decisions on women's bodies, or for white people speaking on behalf of Black, Indigenous, and people of color. Representation should also not be tokenistic nor involve cherry picking. Network representatives should be the first port of call, and there is existing drug user right movement. We are here and we are growing. And there's been a lot of discussion about the global health and the pandemic preparedness. And to be honest, we are hanging by a thread. Our health and well-being have always been politicized. We hardly see any human rights language in any global or high-level documents being passed without any pushbacks. And unsurprisingly, many of these documents also fail to explicitly mention and name our community, people who use drugs, including any recognition of any community-led and community-based service providers as key partners, as well within the governance and decision-making processes. As the report also mentions, we witnessed the critical role of communities during the COVID-19 pandemic on reaching those who are most vulnerable with the life-saving services they need. And these are crucial elements of effective and sustainable global health and pandemic preparedness. However, this will not be realized without repealing all the laws and policies that criminalize people who use drugs and the drugs they use. And that we need to ensure adequate sustained financing for drug user-led services to support the scale-up and effective peer-led service delivery models and innovations, including also to sustain the provision of an equitable access to essential health services, including access to medicines and controlled substances. And let me close by quoting from a member of our network. It says, "Prohibition is the reason we have all these harms. We are overdosing and getting harm and dying because of the war on drug users. When we finally acknowledge and confront the cause of almost all the harms, which is drug prohibition, we will be much closer to finally putting an end to them. Until such time, harm reduction saves lives." Thank you so much.
Thank you, Aditya, for your contribution. We are running out of time, so we have to proceed immediately to the next one, to Carolina Ahumada from American Coalition on Drug Policy. And I think we have a video. She was supposed to be with us, but unfortunately, she's not able, so we will play a video. So thank you.
It's an honor to be here with all of the Vienna and for trusting Intercambios to help organize this consultation, and to all the NGOs which participated in the middle of the summer holidays for some of us back there. I will address specifically progress achieved, the challenges encountered, and the strategies for advancing a more just and equitable approach to drug policy making in the Americas. First of all, the findings from the online survey and regional consultations address the topics of non-compliance of drug policies with international drug control conventions and non-compliance of drug policies with human rights obligations, either jointly or separately. This reveals a mixed landscape. While some respondents, particularly from Africa and Asia-Pacific region, were more optimistic, others, including Europe and the Americas, expressed concern about regression. One of the primary challenges highlighted by NGOs in the Americas is the non-compliance of drug policies with international conventions and human rights standards. Participants emphasized the need for a human rights focused approach to drug policies, advocating for community-based action, and a shift away from punitive measures. However, the absence of a systematic mechanism for addressing non-compliance poses a significant hurdle, particularly concerning the rights of people who use drugs and access to harm reduction services. Discussions surrounding the legalization and regulation of cannabis underscores the complexity of aligning drug policies with international obligations. While some argue that such approaches uphold public health and welfare, others question their compatibility with existing conventions. Some respondents welcome the World Health Organization's critical review processes for cannabis as well for the coca leaf. Particularly among some respondents from Latin America, ensuring a safe, clean, healthy, and sustainable environment to respond and fulfill human rights was identified as a key challenge. Human rights violations related to drug policies are widespread, ranging from criminalization and stigmatization to inadequate access to healthcare, disproportionate targeting of marginalized populations, and negative impacts of drug policies on indigenous peoples, as well as on Black and Brown people. While there was no consensus in the consultation, people called for member states to review and reform the international drug control conventions and system to align with human rights objectives. NGOs played a vital role in documenting this violation, raising awareness and advocating for rights compliance policies. Initiatives such as the Drug Policy Index and the American Drug Policy Coalition exemplify the power of collaboration in driving positive change. Participants also welcomed the resolutions from the Human Rights Council and the recent report of the Office of the High Commissioner for Human Rights. For conclusion, as we look to the future, it is imperative to strengthen collaboration across UN bodies, civil society, and governments to promote human rights-centered drug policies in the Americas. We reaffirm our commitment to placing equality and non-discrimination at the center of drug policy making. By acknowledging the progress made, addressing the challenges ahead, and charting a direction for the future, we can build a more just and equitable society in which the rights of all people, including people and young people who use drugs, are defended and respected. Thank you very much.
Thanks, Sarah, for playing that for us. And we're grateful to Carolina for providing her video intervention on behalf of our Latin American and Americas regional partners that contributed to the consultations. So we have a couple other regional partner interventions that are pre-planned from the floor today, but I can maybe pause for a moment here. I don't see any questions or comments in the chat, but if there is anyone that has something they'd like to share, maybe a reflection on the last couple interventions or a question, yeah, would love to hear from you. And we'll plan to open the floor one more time at the end as well, time permitting, of course, but just give another chance for folks to chime in if they'd like to. But if not, I don't see any hands popping up. That's okay. We can move into our next regional partner intervention, which is from Charity, who is with the African Civil Society Forum on Drugs. So Charity, I believe you're with us live today. And if so, there you are. Great. I'll pass you the floor. Thank you so much for being here with us.
Thanks so much, Nazli, and thanks also for the opportunity and the invitation as well. So as Nazli mentioned, I am Charity Manaring. I'm a member of the African Civil Society platform, and of course, I'm making these remarks on behalf of the platform. So last year, as African NGOs, we had the opportunity to participate in consultations convened by the VNGOC as well as the New York NGOC at the Africa Union meeting that was held in Zambia, where we had essentially the maiden launch of this platform. So the consultations were organized in a hybrid format because most of us couldn't attend in person, so it allowed for more participation. The consultations looked at the 12 challenges identified in the midterm review, and from our broad consultations, it was evident that countries from across the continent were at different levels in their drug control strategies. And diverse approaches are adopted by governments when it comes to drug control, drug policy reform, prevention, harm reduction, treatment, aftercare, and access to controlled medicines. What was also interesting to note is that there was a clear unanimity on the aspect of the consultations that drug use is a public health issue and is not compatible with punishment. So essentially, arresting, incarcerating, and policing people is not the way forward. So it has also become increasingly clear that punishment in drug control systems disproportionately targets people who are most marginalized and vulnerable in our society, such as people who live in poverty or people who are discriminated against based on their age, gender, and economic status. We cannot simply arrest our way out of drug use and the related harms. So I think we can also all agree that the current punitive approaches and enforcement efforts have also contributed to the deterioration of health of people as well as public health at large. Unintended consequences include high exposure of people who use drugs to HIV, as well as other infectious diseases, poor access to primary health care, and harm reduction services, and an increase in avoidable overdose deaths among people who use drugs. I would also like to emphasize the need for us, through our interventions and advocacy, to address drug challenges to try and meet people where they are at. This means that we cannot impose interventions on people, but instead we need to offer a full menu of support and interventions, regardless of whether we work in the fields of prevention, harm reduction, treatment, care, or recovery. We all agree that all interventions must be tailored to the needs of people who experience problems with their drug use, that they should be human rights centered, and that they need to be voluntary. Coerced and forced treatment, including through the threat of punishment, is highly stigmatizing, and it is simply not effective or cost effective according to the evidence. Finally, please permit me to highlight that Africa currently imports and prescribes inadequate levels of analgesic medications, especially compared to developed or even middle-income countries. Consumption rates of the most widely used medication, morphine, demonstrates clearly that pain often goes untreated in Africa. This is particularly worrying because of the fast rising need for palliative care, given the high number of HIV infections among people who use drugs and the fast growing number of cancer patients across Africa. Other essential or controlled medicines underutilized in Africa include methadone, buprenorphine, as well as naloxone. As civil society representatives from Africa, we will collaborate with Africa Union, our national governments, to advance the African Civil Society Common Position on Drugs, as well as the Africa Union Plan of Action on Drugs. Our goal is to encourage a reassessment of commitments under the 3 international drug control conventions, ensuring that drugs are available for medical as well as scientific purposes, and promoting evidence-based, balanced responses to people who use drugs. The African Civil Society Platform on Drugs, though still developing and in our initial stage, is committed to working closely with the Africa Union and its member states to prioritize these recommendations. And we recently did a mapping of over 700 NGO partners across Africa, which will enhance our regional engagement efforts. And we look forward to continued collaboration with the VNGOC as well as the New York NGOC to achieve our objectives. Thank you so much.
Thank you, Charity, for your contribution, and we must say that we are proud of this initiative, which was initiated by the African Working Group, or Vienna NGOC African Working Group, and established as a African Civil Society Forum on Drugs as a consultative body to the African Union's Commission. So this was really a huge improvement, and during the consultation process, it happened, as you said, in Zambia, in Africa, and we are looking forward to see more and to hear more from your platform. So yeah, we have to proceed. We have a limited time still, but I hope we can give some space for questions at the end. We have another video recording from European Civil Society Forum on Drugs, which is a bit older than the African one. It exists for many years, and it presents the platform for European civil society organizations to communicate and to work together with the European Commission and other relevant stakeholders at the European level. So please play a video recording from Marie Nogier as a representative of Civil Society Forum.
Hi, everyone, and thank you for inviting me to be part of this webinar. My name is Marie Nogier. I'm the head of research and communications at the International Drug Policy Consortium, but I'm here speaking today on behalf of the EU Civil Society Forum on Drugs, the CSFD, within which I chair a working group focusing on international drug policy. So last year, in preparation for the Global Civil Society report, the CSFD partnered with the Vienna and New York NGO committees on drugs to conduct a comprehensive consultation on the 12 challenges that are included in the Ministerial Declaration on Drugs in Europe. So we held 3 online consultations and then 1 all-day consultation in Ljubljana. The consultation went well beyond the CSFD membership. It included dozens of organizations from across Europe. And there is a broad diversity of approaches towards drugs and drug laws. Some of these NGOs emphasize drug policy reform, others prevention, harm reduction, treatment, drug user rights, and much more. Bringing this diversity to policymakers is a major strength for us as civil society, but it was also really interesting that there was a clear unity on one aspect of our consultations, that public health is not compatible with punishment. Arresting, incarcerating, policing people is just not the way forward. You cannot deliver support to the point of a knife. So today, I'd like to highlight 3 key points from these consultations. First of all, we have to meet people where they're at. This means that we cannot impose interventions on people, no matter whether we work in the field of prevention, harm reduction, treatment, care, or recovery. We all agreed that these interventions have to be tailored to the needs of people who experience problems with their drug use. They should be human rights based, and they need to be voluntary. Coercion, forced treatment, forced drug testing can be punishment. It can be stigmatizing, and it's simply not effective. Secondly, punishment inevitably targets disproportionately the people who are most marginalized. People who live in poverty, people who are discriminated against on the basis of their race, of their ethnicity, of their gender, their age, or their migration status, and especially people who are facing multiple and intersecting layers of vulnerability. Thirdly, support for people who use drugs must include the whole spectrum of evidence-based health interventions, including prevention, harm reduction, treatment, care, and recovery for all populations. But support should not go just towards medicalized understandings of a drug service and systems of care. It should go beyond that. In many cases, people need housing, they need secure food, a secure income, support to address gender-based violence, and we also need to better understand the intersection between mental health and drug policy. Lastly, I wanted to note that in line with these findings, the Civil Society Forum on Drugs has recently released a policy paper on gender-sensitive drug policies and programs. And more recently, we also adopted, through a decision by a large majority of our members, a position paper in favor of the decriminalization of drug use and possession for personal use as a key measure to protect the health and the rights of people who use drugs. So I'll leave it here. Many thanks for your attention, and I wish you a very fruitful webinar.
Wonderful. Thank you so much, Sarah, for playing that for us. And we're grateful to Marie and the EU Civil Society Forum on Drugs for providing that video intervention. So we have just a few more minutes until we come to the end of our time here. I did see one question in the chat, which maybe we can pick up while people consider raising their hands and adding any last comments and questions before we close. And this question here was about youth inclusion as one of the key stakeholders that drive effective drug policy and interventions in the most vulnerable parts of society. So maybe I can just speak to that with respect to, certainly this came out in our Global Civil Society report. I think you will have heard us identify youth as one of the most important groups throughout a variety of the different challenges. We also really heard this clearly at the launch session of our Impact Coalition in Nairobi, both in the online and in person in the room, I believe as well, but certainly in the online, it was something that we heard repeatedly as youth being such an important stakeholder group to be included, and not in a tokenistic way, going beyond some of the established mechanisms, for example, like the Youth Forum that does exist, but is kind of a separate entity to the CND rather than incorporated with the proceedings. And there were different coalitions as well across the world. One that is relevant, of course, is the Paradigma Coalition, which is made up of a number of different youth organizations that work together and do this work. We do have some folks in the room that I know are part of that. I won't put you on the spot, but if you would like to chime in after, we'd love to hear from you about this as well. And maybe just one other point on youth inclusion is that actually a board member that's on both of our boards, the Vienna and New York boards, Beatrix, has been leading the development of a youth working group. So much like these different kind of regional groups that have come up, the Asia Pacific group, what was an African working group, but has now evolved into the platform. That is another element that we're hoping to build up to encourage and support that stakeholder group to engage in these discussions and be more meaningfully included. But yeah, I'll pause there if there's anyone else that wants to chime in. Yes, please, Charity, go ahead.
Thanks so much, Nazli. I just saw Innocent's response, question rather, around youth inclusion. So I am also the Executive Director of Students for Sensible Drug Policy, and most of our membership is actually in Africa. And so right now what we're trying to do is look at how we can restructure SSDP in a way that we are starting to amplify the voices of young people in the Global South. So this will be one of the things that we ensure that there is youth inclusion locally in our different African countries. So trying to expand our membership as well. So you're more than welcome to reach out to me if you're working with young people or if they need support in being involved in any policy discussions or any work in the drug policy space. Thanks.
Great. Thank you so much, Charity. Thank you from me. I think we'll close it out. Mate, do you want to say goodbye to everyone just before we end?
Yeah, thank you all speakers and those who asked questions and made comments. And thank all participants yesterday and today. It was quite good, two good big groups of people. So we hope you get some good information about some tips and hints how to improve situation in your regions and your countries, and also at the global level. And I also want to thank the Vienna and NGO Committee on Drugs boards and members, and thanks Sarah for technical support. It was excellent, so everything went well, smoothly, and that's all. We will continue to work and update you about the future activities. So let's keep in touch and do some more work together. Thank you very much, and goodbye.
Thanks, everyone. Farewell.
Thank you.
Take
Goodbye.
care.